of the most common things that I talk to my patients about these days is hair loss. As people are losing a lot of weight with medicines like Ozempic or Mounjaro, they often lose weight rapidly and a significant amount of it. They're thrilled with that, but they notice something else going along with it. This is called telogen effluvium. What is telogen effluvium? Well, a hair has 3 cycles during its lifespan. Telogen is the time when it's at rest. And so after a big stressor on the body, it throws your hair into this telogen arrest cycle, and so it falls out. The good news here is that it is not scarring in nature, and it does not generally lead to complete baldness. About 50% or less of the hair is lost. It is alarming, especially when you've put so much effort into losing weight so that you feel better about yourself, and then all of a sudden your hair falls out. Scary, but it does grow back over time. So when a patient presents to me in the office saying that they've noticed hair loss, part of what I need is a good history. So I'm going to talk to this patient about, are they on any new medications, or has there been something very stressful in their life, or is something else going on, recent surgery or a major illness. I've been seeing it a lot in the last few years with our fantastic newer weight loss medications, and also I have seen it a lot in patients after COVID. An interesting thing about telogen effluvium is that it usually presents about 2 to 3 months after the inciting or stressful event, and then generally within 6 to 12 months the patient will start to notice that hair regrowing. We need to rule out other causes of hair loss. Low thyroid is one that I see pretty significantly. There is also hair loss called anagen effluvium, and we see that with things like chemotherapy, and we expect to see it with that. There's also androgenetic alopecia, which is male or female pattern baldness. You can look across your family to see if everybody loses their hair. It may just be a genetic predisposition. There's also a phenomenon called alopecia areata, where just a small, usually round area of hair falls out in one place, and it can be alarming. The good news is that hair generally grows back. If there's something abnormal about this pattern, or if your doctor sees something abnormal looking on your scalp that may lead them to believe that there is some sort of infection or other underlying inflammatory condition, they may want to send you to a dermatologist, which could include scrapings of the skin or even a possible biopsy. What we're talking about today is telogen effluvium, and this is actually in the absence of any scalp abnormality. Your head just looks normal. The hair that falls out is also normal. So if you notice that the hair is broken or appears damaged in any way, that's a different kind of cause. One of the ways that I explain this to my patients is, let's go back to biology. Our bodies are made to survive. So when there is some big stressor, our body says, uh-oh, I need to divert resources to things that help me survive. And the least important thing on that list is hair growth. So if you have undergone a major surgery, a severe emotional distress, some sort of a trauma, whether that's emotional or physical, or a serious illness, then it's not unusual for you to experience a significant amount of hair loss after that happens. Another thing that we want to do in the workup of this is check some routine lab work to make sure that you're not deficient in something that's easily reversible. Vitamin D deficiency has been associated with hair loss. Anemia can be as well, as is low thyroid. So your doctor's probably going to want to run some cursory lab tests to make sure that there's not something else going on. In the absence of those, if you have no other medications that may be the problem, if you have no other physical characteristics of some sort of disease process, then we're usually left with this diagnosis of telogen effluvium. The good news and the bad news here is that it just grows back over time. There's really not anything that we can do to make it turn around any faster. So once we have our diagnosis, then we're left with what to do. Well, most of the time it's just wait, and eventually that hair will grow back. If people are really concerned about it, or if it is significantly affecting their appearance, then we just recommend some simple things to do to buy yourself some time until that hair grows back. It may be worth getting a different hairstyle, going a little bit shorter. This happened to me after I had my weight loss surgery, and my hair was very long at the time, and I liked to tell people that I felt like I looked like Gollum from Lord of the Rings. So, my solution was to wear my hair curly for a while, and that helped to kind of obscure it. I also have darker hair, so it helped to cover up my scalp a little bit better. But you may even want to look at finding some sort of camouflage, whether that is hair extensions or other hair prosthetics short term. We don't recommend hair transplants because this is actually healthy skin and the hair will grow back. So we don't want to do something that's going to traumatize your scalp anymore. So I had a friend that had this happen. She would just wear bows and other things on her head, other baubles and things to cover up the area that she felt like it was most noticeable. And changing hairstyle, changing hair color, etc. could be very helpful in the short term. Also, from personal experience, I would recommend that you use a hat when you're going to be outside. Also, you may want to put some sunscreen on your scalp in the areas that your hair parts, because I wound up with a couple of sunburns on my head before my hair all grew back. You could certainly try taking supplements like biotin or collagen. Just be mindful of the fact that if you're going to be having labs done, a biotin supplement can interfere with thyroid labs, and that's one of the things that we generally check when hair is falling out. So you want to make sure that you discontinue that at least 3 to 5 days before you anticipate having any blood drawn, because you don't want to interfere with those labs that may be critical in helping getting you feeling better. One of the things I would say to reassure you is that people are probably more noticing how fantastic you look after you've lost all of this weight with your medication. So enjoy that. Don't worry as much about your hair. It will grow back. Change your hairstyle a little bit, and in 6 to 12 months, you'll be looking the way you were before. Try not to fret too much. Don't forget to like and subscribe, and stay tuned for more.